It's Thursday, November 7th, and this is the Daily Medical News, where we bring you the top headlines in clinical medicine, plus a closer look at today's biggest story. I'm Molly Collegio.
And I'm Nick Andrews. Today, why social media is a location for crowdsourced STD diagnoses.
Sepsis is particularly dangerous for previously healthy patients.
A federal court puts a temporary halt to a plan linking health insurance and immigration.
And how families are facing the challenges of gene therapy for rare diseases.
Plus, the American College of Physicians outlines its recommendations for colorectal cancer screening in low-risk adults. But first, a thanks to all of you who've helped us make this podcast better by taking our short listener survey. We encourage those of you who haven't to complete the survey by following the link in the show notes. And now, the news.
Requests for crowd diagnosis of sexually transmitted diseases were frequent on the social media website Reddit. Reddit is home to more than 230 health-related subreddits, including r/STD, a forum that allows users to publicly share stories, concerns, and questions about anything and everything STD-related. In a research letter published in JAMA, researchers at the University of California, San Diego, presented findings from their analysis of nearly 17,000 posts published to r/STD during November 2010 to February 2019. They recorded whether or not a post requested a crowd diagnosis, and if so, whether that request was made to obtain a second opinion after a visit to a healthcare professional. About 58% of posts requested a crowd diagnosis, 31% of which included an image of the physical signs. 1/5 of the requests for a crowd diagnosis were seeking a second opinion after a diagnosis by a healthcare professional. Nearly 90% of all crowd diagnosis requests received at least one reply. The investigators say the findings could offer an opportunity for clinicians. Healthcare professionals could partner with social media outlets and respond to such posts with diagnosis information and referrals to healthcare centers.
It's relatively uncommon for previously healthy U.S. adults to develop severe community-acquired sepsis. But when they are hospitalized for severe sepsis, their rate of in-hospital mortality is twice the rate of hospitalized sepsis patients with one or more comorbidities. That's the troubling finding from a study by researchers at Brigham and Women's Hospital in Boston, who presented the data at ID Week 2019. The investigators reviewed data from more than 330,000 patients hospitalized for community-acquired sepsis. They found that the rate of in-hospital death among previously healthy patients was exactly twice the rate of those who had at least one major chronic comorbidity. The researchers hypothesized that the increased sepsis mortality may stem from factors such as delayed sepsis recognition, which led to hospitalization at a more advanced stage, and previously healthy patients may receive less aggressive management. Those potential causes highlight the need to improve public awareness of sepsis and emphasize early sepsis recognition and early treatment.
A federal district judge has temporarily blocked an order by President Trump that would make having health insurance or the ability to pay for medical care a requirement for immigrants seeking U.S. visas. The judge cited serious questions about whether the immigration rule was arbitrary and capricious, thereby violating the Administrative Procedure Act. Under the planned rule, visa applicants would have to demonstrate that they can obtain coverage by an approved health insurer within 30 days of entering the U.S. Alternatively, they must show evidence that they possess the financial resources to pay for foreseeable medical costs. President Trump said that the restriction would protect Americans from bearing the burden of uncompensated healthcare costs generated by immigrants. The nonpartisan Migration Policy Institute estimates the new requirement may restrict up to 375,000 prospective legal immigrants from moving to the U.S. annually. We'll be back after this message with more medical news.
Welcome back to the Daily Medical News. As gene therapy to treat rare diseases advances, more work is needed to make the experience easier on patients and on their families. That's the recommendation from panel members at the NORD Rare Diseases and Orphan Product Breakthrough Summit held by the National Organization for Rare Diseases. For the families of patients with rare diseases undergoing gene therapy, challenges include struggles such as language barriers and separation from other family members for extended periods. A survey of families with children in gene therapy trials found they spent an average of 5.5 months in the city where the trial was conducted, and they spent an average of 48 days in an isolation ward with their child. Parents' 5 biggest challenges were financial well-being, isolation or being away from support systems, fear of the unknown and long-term treatment diagnosis, family separation, and caring for other children simultaneously during the trial period.
Asymptomatic patients aged 50 to 75 years should undergo regular colorectal cancer screenings, with regular screenings ending after 75. That's according to a new evidence-based guidance statement from the American College of Physicians. The statement's authors say no one test is preferred over another. Patients and doctors should select a test type together based on individual needs and preferences. A fecal immunochemical test or fecal occult blood test should be performed every 2 years. Colonoscopy should happen every 10 years. And flexible sigmoidoscopy should be every 10 years in combination with a fecal immunochemical test every 2 years. While each test carries its own screening interval, the authors say any type of regular testing has been proven to reduce the risk of colorectal cancer mortality. The guidance is an attempt to balance existing guidelines authored by the U.S. Preventive Services Task Force and the Canadian Task Force on Preventive Health Care. It was also developed following critical review of those existing guidelines from the American Cancer Society and other organizations. The ACP guidance is for adults at average risk for colorectal cancer who don't have symptoms. It doesn't apply to adults with a family history of colorectal cancer, a long-standing history of inflammatory bowel disease, genetic syndromes such as familial cancerous polyps, a personal history of previous colorectal cancer or benign polyps, or other risk factors. And that's it for today's Daily Medical News. Be sure to catch the newest episodes of Dermatology Weekly and Blood and Cancer, available today and every Thursday. For MD Edge, I'm Molly Collegio.
And I'm Nick Andrews. Thanks for listening to the Daily Medical News.